Hello, it's a Wednesday night and here I am with what you are expecting, the news with the extra touch. You know, unusual times demand unusual actions, and you all agree with me that these are unusual times. Expectedly, News Extra is unusual but not uninteresting with the coronavirus global pandemic. Not much else is news. So tonight, we shall dwell on the dominant newsmaker around the globe for now. Coronavirus. It's spread in Nigeria. What is being done about it and how Nigerians are reacting? Well, let's not waste much time but get it, as the taste of the pudding is in the eating, irrespective of the taste. National Center for Disease Control (NCDC) confirms new cases of COVID-19, one in Lagos and one in Osun State, bringing the number of confirmed cases to 46. Active cases are now 43, 2 have been discharged and 1 death recorded. It is well known that the weekly meeting of the Federal Executive Council did not hold this Wednesday. In fact, the highest policy decision-making body of the Nigerian government will not meet until further notice. But what is the situation in the nation's seat of government as a result of measures being taken to contain coronavirus pandemic? Well, State House correspondent Adamu Sambo is now standing by for an update. So, Adamu, what can you tell us about it?
Yes, studio. The Federal Executive Council meeting, usually held here in this hallowed chamber behind me, now under lock and key, did not take place this Wednesday. And as you have said, no one can tell when the next meeting will be held. The high-powered Presidential Task Force on COVID-19 announced the suspension of the Federal Executive Council meeting as a precautionary measure against the spread of the global pandemic. But what happens if any major decision is to be taken that requires the approval of the council?
You have over 50 people seated in the council chambers whenever the meeting holds, and that is not advisable at a time like this. But if there will be a very important decision to be taken, you can always summon the relevant people, 3, 4, or 5, and hold a small meeting and arrive at a decision.
So how will you describe the situation in the State House at the moment regarding presidential activities?
Well, things are a bit on a low key. It's not that the State House is shut down, it's just that it's on a low key, just like the rest of the country.
So is it true that a test was carried out on President Muhammadu Buhari on COVID-19?
Well, what did you hear about the result?
They say it's negative.
Good. So that calls for rejoicing with him. Anybody that does the test and tests negative, we rejoice with that person. And anybody that does it and tests positive, it's not a death sentence. We also would pray along with the person, give the person our goodwill and best wishes, and they will surely come out of it.
There have been reports in the media that the presidency has banned some media houses from covering the president. How true is that?
Banned is a wrong word. Anybody that uses that word ban is just operating from a mindset. What happened is that in the press gallery, you have about 108 journalists in that single hall. And it goes contrary to the spirit of the times. The times dictate that you don't have too many people congregated in one place. Not much is happening for now. Let the journalists stay away, but we picked a certain number, representative of the media. They will come in. If there is anything, they will cover. And those outside will also not miss.
So in situations like this, what other measures has the presidency taken towards containing the spread of COVID-19?
In the State House, of course you know that when you come into the State House, you have about 3, 4, 5 spots in which your temperature is tested and you have to sanitize your hand. And if you come in and your temperature is way above a certain figure, then you will be advised to go for test and to take care of yourself. So I think so far so good.
So is there a need for panic at times like this?
No, panic would not be the right thing to do. Because when you panic, you are bound to make mistakes. When you panic, you get agitated. And the situation does not call for that. Rather, it calls for cooperation with government when they give instructions, let's abide with those instructions, and a number of things have been put in place to ensure that the well-being of Nigerians is taken care of.
There is now serious restrictions on visitors and the staff that have to come to work, as Mr. Adeshina said, are being thoroughly screened as a precautionary measure. Back to you in the studio.
Well, thank you so much, Adamo. Now, the leadership of the National Assembly says an immediate review of the 2020 budget and medium-term expenditure framework is imperative, particularly against the backdrop of the impact of the coronavirus pandemic on global economy. The meeting, presided over by the President of the Senate, Ahmed Lawan, has in attendance Speaker of the House of Representatives, Femi Gbajabiamila, some ministers and head of agencies from the executive arm of government, which brainstormed on the impact of coronavirus pandemic on the Nigerian economy. The meeting specifically touched on the planned review of the 2020 budget and the medium-term expenditure framework and fiscal strategy paper passed late last year by the National Assembly. Minister of Finance Zainab Ahmed said prior to COVID-19 and oil price decline, the Nigerian economy was already fragile and vulnerable, and that the budgeted revenues for the Nigerian Customs Service have been reduced from 1.5 trillion to 943 billion due to anticipated reduction in trade volumes and privatization proceeds to be cut by 50% based on the adverse economic outlook on sales of the Independent Power Project IPPS and other assets. Governor of the Central Bank of Nigeria, Godwin Emefiele, said while a decline is expected in growth projection for 2020 relative to 2019, the exact impact will be dependent on how well the coronavirus is contained over the next few months and how long low oil prices persist. The world has recorded over 450,000 cases of coronavirus with about 21,000 deaths. Meanwhile, help has begun to come the way of Nigeria as the federal government took delivery of its first COVID-19 medical items from Jack Ma Foundation in China. Emmanuel Ayimiro is at the cargo section of the Nnamdi Azikiwe International Airport, Abuja, to tell us all about it. He was there actually earlier today.
The items landed in Lagos yesterday and evacuated to Abuja by the Nigerian Air Force C-130.
This consignment first landed in Addis, Ethiopia. He sent a whole cargo of aircraft for all the African regions, and our own beat is what you are seeing here. It's about 20,000 test kits, about 2,000 gowns, and about 100,000 masks that we are using.
That this virus is imported into the country and everyone coming in has had to pass through port health. It underscores the importance of the value of these items because the officers at the ports must be kept safe to be able to continue to do their work and keep the rest of Nigeria safe. So that makes it very important, and we appreciate these items that have been donated, and it will help us to do our job better and to keep ourselves safe and keep Nigerians safe.
We expect that more of such donation should come the way of Nigeria. Are we expecting any?
We have last 2 days we had a cause to meet with the members of United Nations system, and we have received several offers, and the task force is right now compiling a list which hopefully by the time they come to fruition they'll be made public to the Nigerian people.
We want to find out what is the compliance level. Yesterday the international flight was suspended in Abuja.
I want to confirm to you that we have provided all enabling environment for the port health to operate in Abuja airport. And by 12 midnight, we are able to close Abuja airport with the exit of Turkish Air, which departed to Istanbul with about 180 plus 3 passengers. So the airport is now closed up and all facilities that are in there are also available at the domestic terminal now. So if you go there, you will find people being screened by Port Health at the entrance and exit of the airport. So we want to ensure that all we could to make sure that this thing is checked at the airport.
This time of
Thank you, Manuel. Now, Abuja State Task Force on COVID-19 and Lassa fever has set up 3 isolation and holding centers across the state. Mahmoud Ibn Mohammed reports that the task force has also procured drugs and consumables for usage at the centers.
As Bauchi State awaits the results of 27 more persons who are said to have come in close contact with the index case, authorities in the state have continued with contact tracing.
Waiting for approval from the NCDC. We have identified where we are going to buy testing kits, but we have to get approval from NCDC to be able to buy those testing kits.
In order to forestall the spread of the disease in the state government has directed for the closure of all markets in the state.
Except for food items and pharmacies and medicine and drugstores. And this order will be followed strictly.
In Bauchi, Mahmoud Ibn Mohammed, NTA News.
Now, thank you so much for that update all the way from Bauchi there, Mahmoud. Now, 7 persons have been placed on isolation in Niger State for COVID-19. The State Commissioner for Health, Dr. Mohammed Mokunsidi, who disclosed this in Mina, says they are under self-isolation. And Suleiman Kodogi reports.
The State Commissioner for Health, Dr. Mohammed Mokunsidi, who disclosed this at a press briefing in Mina, said that out of the 7 people, 1 is in Suleja, while 6 others are receiving attention in Mina. He explained that the person in Suleja was exhibiting the symptoms of COVID-19, had to be isolated, while one of those in Mina just returned from the UK. The remaining 5 cases, the government said had contact with someone that has a confirmed case of coronavirus and have to be isolated too.
When this plane took off in the UK, when they were airbound, we already have information that some people are going to come into Niger. So we're even ready. We started tracing who are these people that are coming. And the moment they arrive, after passing the checks at the airport, we also follow them down to where they are. And again, by the arrival of that person to Niger yesterday by 9 a.m., within 1 hour or thereabout, we also got the information and we swung into action and we were in touch with NCDC and that person.
Meanwhile, a 28-man task force has been constituted on coronavirus with the Secretary to the State Government, Ahmed Ibrahim Matani, as head. In Mina, Suleiman Kodogi, NTA News.
To a cheering one now, the chairman of a Nigerian Governors Forum, NGF, and Ekiti State Governor, Kayode Fayemi, has tested negative to coronavirus COVID-19. The governor, who isolated himself earlier, also advised his colleagues to undergo same. Ayodeji Ogunsakin reports that apart from shutting down markets, the state has evolved other measures to check the spread of the virus.
Since the outbreak of deadly coronavirus in the country and Ekiti State recorded an index case, there has been increased precautionary measures against the spread. The measures evolved by the state government ranges from constitution of different committees and task force to ensure strict implementation and compliance, public enlightenment, shutting of schools, enforcing ban of public, religious and social gathering of more than 20 people, among others.
We have a congregation of about between 150 and 200 on a normal Sunday, but we had to distribute ourselves to several centers so that we can obey the law.
And I've been encouraging the people that I met. Prevention is better than cure.
The Ekiti State government also fortified the quarantine center at the Obadi Jube General Hospital, where the index case is being treated.
At this time, the patient, which is the index case for Ekiti State, is stable. Presently, we have partners that have come to the state.
People have now embraced the use of sanitizers and hand washing, especially government offices and public places, while workers in the state complied with the state at-home order, except those on grade level 13 and above.
Staffs in the ministry generally most of them are in their offices now, in compliance with the government directive.
Taking precautionary measures, all our conveniences have soap and running water.
Government also provided free transportation for students of higher institutions in the state to convey them to their various destinations outside the state.
Just wants to safeguard them from getting contact of this, and also we're giving them free sanitizing.
Respondents were of the view that if people should follow the precautionary measures, there is hope in sight of an end to the dreaded disease in Nigeria. From Ado-Ekiti, Ayode Joguchaki, NTA News.
Well, we pray. So now from Ekiti, we'll take you to Lokoja, and following the number of contacts with a lot of presence during and after the burial of his mother, the Kogi State Governor Yahaya Bello and his close aides have embarked on self-isolation for 14 days as part of prescribed measures to curtail the chances of contracting and spreading the COVID-19. A statement by the Chief Press Secretary Onogu Mohammed states that the governor had close contact with some personalities who are said to have tested positive to COVID-19, and the governor and his close aides have not shown any symptoms of COVID-19 so far. And Governor Bello called on all citizens to observe social distancing and high-level personal hygiene. And as the Nigerian government continues to take series of measures in curbing the spread of the coronavirus in Nigeria, stakeholders have welcomed the partial lockdown order. Even our security operatives express readiness to ensure strict compliance. Guest on NTA's program, Good Morning Nigeria, made these submissions while discussing the subject, COVID-19, coping with isolation and lockdown. Oluseyi Adiagbo has the details.
We basically asked the chapter chairs to take a survey of all Nigerians in that particular country through also that hotlines to report exactly the cases we have. So far, we have one case in Italy. A Nigerian has been quarantined. We had this responding very well, and also one in Portugal.
Ken Gandhi, chairman Nigerians in Diaspora organization via Skype from Germany, shared some of the experiences of Nigerians in several European countries currently under lockdown. He said they are coping well with the situation, with only 2 Nigerians confirmed to be positive of the virus as at the last count. The guest commended the efforts of the Nigerian government at all levels in the face of lack of adequate health facilities. They called for massive enlightenment on isolation and potential lockdown situation, which they say must be all-inclusive.
Government needs to incorporate this in part of the strategies. The groups that are set up to implement these decisions, they need to include psychologists in particular, to help in this process.
On the state of security during the stay-at-home order, Force Public Relations Officer DSP Frank Umba and Deputy National PRO, Nigeria Security and Civil Defense Corps, DCC Shola Udumosun say their mandate is to support strict compliance of every order given by the government.
Where anyone or group of persons remain recalcitrant and is out to disobey these restriction orders, we will be out there to enforce them.
Nigerians who reacted via NTA German Twitter handle commended the media outfits across the country, especially the NTA, for prompt information dissemination on COVID-19 preventive measures. In Abuja, Oluseyi Adiagbo, NTA News.
In another development, the Federal Capital Territory Administration has provided a facility in Edo District that will serve as an isolation and treatment center for COVID-19 patients, should the need arise in the territory. FCT Minister Mohammed Musa Bello made this known during an inspection tour of the facility. Shuaibu Noza Yakubu tells us more.
The 5-story building located at Edo district of the FCT is a new training facility that can be modified to suit the purposes of a treatment and isolation center as required by the health authorities.
As you can see, the most critical thing is that this place has a lot of space. We are talking of 5 floors. I don't think the whole of Abuja we have a building, a hospital facility that can accommodate up to 5 floors. More importantly, there is power here, constantly 24/7 from massive generators, and there is adequate water supply. So why we are here with the experts is to see if this place would be suitable for them, and I leave it now for the officials of the Federal Ministry of Health, Nigerian Center for Disease Control, and of course our public health official.
Acting Secretary Health and Human Services Secretariat, Dr. Muhammad Kawu, says the 300-bed-based facility is ideal for COVID-19 patients in the territory if the need arises.
Just an issue of conversion. You convert, if we have to convert it, we still have some treatment centers that are still available. But should in case we need more spaces, certainly this is going to be one of the ideal places that we can use.
Once the fund is available, and which I know the Honorable Minister will gladly, with the Presidency, release fund now. Even if it is tomorrow, we start working.
However, multiple health centers were being prepared across the territory in case of an escalation in the number of confirmed cases of COVID-19 in the FCT. Shuaibu Onoziaku, NTA News.
Many thanks, Shuaibu Onoziaku, for that. You're watching News Extra on the network service of the NTA. And still to come, transportation sector nears standstill to curtail a rapidly moving virus. Plus, religious and traditional leaders join conversation on adhering religiously to health and safety tips. Good to know you're still with us on News Extra. The people seem to be aware of coronavirus and have developed self-means of protecting themselves against the pandemic. And Salihu Abdullahi was at Nyanya popular motor park where a unique sanitizer is used as a guard against COVID-19.
This is Nyanya Motor Park in Karu area of Nigeria's capital city, Abuja. The park is a major hub for transportation services for a large number of people working or doing business in the Federal Capital Territory. Despite the ban on public gatherings as a result of the coronavirus pandemic, Nyanya Motor Park remains choked up. The people are, however, not unaware of the dangers their being here poses. Consequently, some have devised means of protecting themselves from the virus.
I use it for my passengers alone. Anybody enter my motor, before you enter, I will use it for your hand.
Sorry, do you have a hand sanitizer?
I cannot have, please.
What of your nose cover?
I don't have money to buy. I'm at the hustle money to get.
We are doing our best to stopping people to shaking for hands and making people to know that there is a virus here all the country, not only the country, all the whole world.
Face masks are very expensive, they are scarce. Even hand sanitizers are expensive and scarce. So what can we do? Nothing. But we also have to keep moving until maybe when the government say nobody should move again.
Here Nacho with unique liquid sanitizer just shows how much the people know and go about fighting COVID-19. Drinking its content, he believes, will help sanitize his internal organs.
We be driver, we are managing this park. At least we're supposed to have some things to cover ourselves, because if it affects us, it will surely reach them. Let them come and help us.
Attempt to speak with the management of the park on further preventive measures was unsuccessful.
Nyanya Park is still alive to its usual activities, and this park will be significant in the fight against the spread of coronavirus as people travel from this park to all over the country. From Nyanya Park in Abuja, Salihu Abdullahi, NTA News.
Well, thank you so much, Salihu. It's necessary for us to guard ourselves, wear our face masks, and use hand sanitizers. But for children out there, please don't drink hand sanitizers. It's not good for your health. Now, federal government stopped all train movement across the country with immediate effect. A statement by the managing director of Nigerian Railway Corporation, Fidet Ohiria, indicates that the move is part of the precautionary measures to check the spread of coronavirus in the country. While government at all levels try to control the spread of coronavirus in Nigeria, the concern of residents of Uyo bothers on how well those entering into the state through land and water are screened. Edith Young Iba reports that the motor parks are the major areas of concern and plans by the state government to ensure safety.
As at the time of this report, suspected cases of the coronavirus in Nigeria had risen to 36, with the first death recorded, according to the Nigerian Center for Disease Control, NCDC. Different measures have been put in place by various organizations to control the spread of the pandemic in Akwa Ibom State, as the government says they have put in place measures to curtail the virus should it get to the state.
We had set up a protocol to screen, detect early and act early if we find a patient that is suspected to have COVID-19.
At the Victor Atta International Airport, screening of passengers is an ongoing exercise. But however, what worries most residents of the state is the fact that persons who come in through the roads and waterways are not screened for the disease.
Checking people that are coming in from outside the states, no, we don't have the equipment, we don't have the facilities to do that for now.
If you go to any state in the country, there's no place that they are screening and cautioning the parks. There are many bush tracks and routes people are coming. Farmers go through those routes on motorcycles and keke. They don't pass the main road. So you really cannot screen all those routes.
While the government and its agencies try to ensure that COVID-19 is not allowed to spread in the state, it behoves on citizens to take responsibility for their health by being conscious and maintaining personal hygiene. In Uyo, Edidion Iba, NTA News.
Personal hygiene very necessary. In the meantime, the Federal Fire Service is raising awareness on safety tips to minimize risk of fire outbreak while workers and other businesses stay at home to curb the spread of coronavirus pandemic. Abubakar Usman Akwanga reports.
Safety first is a slogan that has been accepted the world over, and one agency that is ensuring safety as a mandate is the Federal Fire Service. Now, the coronavirus pandemic is forcing government at all levels to take measures that will stop it on its track, and staying at home is a major strategy being adopted. To the Federal Fire Service, that also has its implications, and it is moving fast to educate families on safety measures to observe during the confinement period.
Staying at home at this present period, as important as it is, we need to be safety conscious.
The Federal Fire Service explains that increase in domestic activities could expose homes to fire outbreak, and appealed to parents to ensure combustible materials are kept out of the reach of children. Hand sanitizers were also said to contain ethanol, which is highly inflammable, and called on the public to pay adequate attention to the danger inherent on the product to secure lives and property. In Abuja, Abubakar Usman Akwanga, NTA News.
Still on coronavirus containment, Abdullahi Musa Salejo reports that religious leaders have joined the conversation to encourage the faithful to diligently observe all health protocols religiously.
Health, they say, is wealth, an old adage underscoring the importance of health to human life. In discharging its responsibilities, which is one of the rights of the citizenry, government makes sure that people's lives are secured by providing healthcare facilities and being proactive in the event of any outbreak of disease or accident. These roles have been played by the authorities at different levels since the beginning of the importation of coronavirus. But while relevant health authorities are guiding the populace on some do's and don'ts to curb the spread and mitigate the effect of the virus, some turn deaf ears to the advocacy, exposing the country to more dangers. Now, religious leaders are drawing the attention of adherents to the fact that both Islam and Christianity recognize disease outbreaks and admonish the faithful to heed the counsel from medical experts and complement with prayers to the Almighty.
Christians are known for praying at good and bad times. These are bad times, and this calls for more prayers. But we also need to be strategic in our behavior. The medical experts are advising us on what to do and what not to do. We must be attentive to their counsel. We keep praying and hoping for the best, that this will not go beyond where we are.
The sunnah of Rasulullah is that Islam allows when there is heavy rain, people should pray at home. So it's not a new thing, and especially when the health personnel have been informing us that this thing transmits with contact. That's why Rasulullah says if there is this type of pandemic disease, people should not live where they are, those who are affected, so that they will not contaminate others. And those who are not affected should not go to them.
The clerics say the faithful should move closer to God at this trying period to seek divine intervention to heal the land of coronavirus and other elements afflicting the society. Abdullahi Musa Sleja, NTA News.
Meanwhile, Etsunupe and Chairman Niger State Council of Traditional Rulers, Alhaji Yahya Abubakar, has called on the people of his domain to maintain high level of personal hygiene in order to prevent outbreak of coronavirus in the area. The monarch was speaking at a sensitization program on curtailing the outbreak of coronavirus and Lassa fever by officials of the Federal Medical Center Bidda, held at the Wadata Palace. Jones Ajayi completes the story.
Present at the sensitization were district, village and ward heads, religious leaders, as well as officials of the road transport unions and their motorcycle counterparts. Etsunupe and Chairman, Niger State Council of Traditional Rulers, Alhaji Yahya Abubakar, described the coronavirus, also known as COVID-19, as real. As such, there is the need to be vigilant so as to avoid its outbreak. He emphasized that the sensitization became necessary to enable those present return to their various places and enlighten their people about the coronavirus as well as Lassa fever. Yahya Abubakar pressed it on his subjects to ensure that they maintain high level of personal hygiene so as to guard against contracting the virus. He also employed them to obey the rules laid down by government at all levels, especially as it concerns large gatherings.
We need to take very, very strict measures to ensure that we actually eradicate it and then wipe it in total.
In his remarks, the medical director of Federal Medical Center Bidda, Dr. Mohammed Aminu Usman, said the center is adequately prepared to contain the coronavirus in case it is recorded in the area.
We have our isolation center, we've reviewed, renovated it, but most importantly, we have primed our staff to be on the lookout so that we'll be able to safeguard ourselves, be able to secure the patient, of course, and secure the larger community.
The doctor demonstrated how they should wash their hands always. The district, village and ward heads had earlier washed their hands before attending the sensitization. Jones Ajayi, NTA News.
President Muhammadu Buhari says his administration will continue to do whatever it can to ensure the protection of lives and property of the citizenry. Abubakar Hamman reports that the president stated this in a message by the secretary to the government of the Federation, Bas Mustafa, to Garkida community in Adamawa State, who were recently attacked by Boko Haram insurgents.
The secretary to the government of the Federation, Boss Mustafa, who visited Garkida community on behalf of the president, told them that President Buhari mandated him to commiserate with them over the ugly incident. He said he was there to see the level of destruction done by the insurgents and report back to the president in order to have a clear picture on critical areas that need prompt action. The SGF was taking around all the critical infrastructures destroyed by the insurgents, like worship centers, individual houses, schools, trade centers, and government outfits. All leaders of the worship centers damaged as a result of the attack commended the president for the show of concern and pledged that no matter how the evil actors strive, their actions will not ever bring division among the Garkida community who were together as a single family, irrespective of all affiliations.
My heart goes out to the community, the leaders and the people of this town. I've come on behalf of President Muhammadu Buhari to commiserate and empathize with them over this very, very unfortunate act.
Shortly after visiting the affected places, the SGF used the forum and enjoined community and religious leaders to cooperate with government policies on COVID-19 pandemic.
be responsible to maintain personal hygiene and maintain some social distancing, because coronavirus is more deadly.
The SGF also handed over some trucks of relief materials to officials of NEMA in the area for onward sharing to affected people to ameliorate the effects. In Yola, Abubakar Hamman, NTA News.
Thank you, Abubakar. We'll pause for some messages now, but in our next segment, markets shut. Hand sanitizers distributed as governor steps to protect citizens. Stay with us. Thanks so much for staying. It is true that getting the right cure for coronavirus has become a global competition among nations, scientists and researchers. The United States, China and Europe are slugging it out to emerge the first producers of the vaccine or the drug that can deal with the virus. So when the US President Donald Trump announced that chloroquine was a powerful treatment against the disease, many Nigerians used the drug without seeking medical advice. Now, Thomas Ogbetere engaged a medical consultant over this trend in Lagos, and this is the outcome.
Since the advent of COVID-19 pandemic that has affected the economies of several countries negatively, Nigeria inclusive, governments of different countries no doubt have been trying their best possible to find lasting solutions by way of researching for vaccines or drugs for the treatment of the disease. This has, however, also led to rumors and counter-rumors of different drugs said to possess the efficacy to cure the disease.
President Donald Trump, he made mention of chloroquine as part of drugs that has been approved to cure COVID-19. You know, Nigerians, without doing much finding and much ado, they begin to take the, even without being confirmed positive.
A doctor advised us not to use it unless it is recommended by a medical expert.
A medical consultant in the Federal Medical Center, Yaba, Dr. Lanre Ajayi, was quick to let us into the source of the rumor that made many to indulge in such self-medication.
A small study was done, I think somewhere in France, where they tried hydroxychloroquine on some COVID patients, a very small study, and they felt that it helped. In the study as well, they also combined azithromycin with a hydroxychloroquine on some patients, and they felt they improved. But that's just what it is, a small study, which suggests that the use of the combination of these drugs might help.
Dr. Lanre, however, advised Nigerians on the dangers associated with indiscriminate use of chloroquine and other self-medications.
And what most people are buying here is actually chloroquine phosphate, which is actually a different molecule from hydroxychloroquine that was used in the study. So that's, for me as a doctor, nothing is ratified. It's not right for people to just go ahead and say they are buying chloroquine phosphate because they've heard that it works.
Dr. Lanre Ajayi also called on Nigerians to maintain a social distance from each other. In Lagos, Thomas Ogbetere, NTA News.
Well, that is very, very educative, because 2 to 3 days back on the social media, someone died because of this chloroquine thing. He kept on injecting himself and he died. Very, very unfortunate. Now, defending the territorial integrity of the country from threats through land, sea and air, the armed forces of Nigeria is faced with a new unseen enemy. The rampaging coronavirus. Is the Nigerian military prepared to defend Nigerians against the spread of this enemy? Well, correspondent Najata Tijani investigates.
Adding protective gear to their uniforms, these military personnel are fighting a battle off the battleground. In addition to the temperature scan, a strict code of sanitation, long in place before the coronavirus was classed a pandemic, also observed within the ranks, says the Nigerian military. On arrival, the NTA crew was subjected to body temperature checks using the infrared thermometer, and it was observed that no rank was too great or small to pass through the process at the Defense Headquarters. Coordinator of the Directorate of Defense Media Operations, which represents the Nigerian military, says this foresight has prevented infection within its ranks, though one case has been confirmed.
We have one of our colleagues who went for an assignment outside his country, came back, and unknown to him, he started feeling sick. He was eventually isolated and taken to Gwagwalada Teaching Hospital for management. That is the only known case.
But how prepared is the Nigerian military in the event of a national outbreak?
4 of our military medical establishments that are being considered, or have been considered rather, as centers to isolate and manage it. As I speak with you, it has been increased to 6.
Beyond deploying hand sanitizers and disinfectants, the Armed Forces of Nigeria says it is already well versed in the art of war. And this scenario is no different, as it is doing everything it can to contain the spread of the virus within and outside its ranks. Naja'atu Tijani, NTA News.
Thank you, Naja, as we call her. Now, towards checking the spread of COVID-19 in Abia State, Governor Okeze Ikpeazu has distributed 70,000 hand sanitizers and 10,800 buckets for hand washing to primary and secondary schools in the state. And Chinyere Okoli reports.
Governor Bazo, while addressing stakeholders, noted that coronavirus is not a death sentence, but an ailment that requires community efforts to deal with, and urged Abia residents not to panic as the state has taken preventive measures to forestall the dreaded virus. He formally distributed over 70,000 hand sanitizers and 10,800 buckets to all schools and announced the suspension of convocation of one of the universities in the state, as well as immediate closure of the institution and other tertiary institutions in Abia. He promised to provide 10 million naira to all tertiary institutions to continue online lectures while at home.
If your temperature is okay, then you are free to go. But if your temperature is okay and you feel that you have exposed yourselves to people who are likely, who may likely infect you, you may also do a test.
Abia State government has already set up 3 COVID-19 isolation centers at Amateur General Hospital, Umuahia, Abia State University Teaching Hospital, Aba, and the Federal Medical Center, Umuahia, as well as Abia Telehealth Center on a 24-hour dial a doctor initiative for any emergency. In Umuahia, Chinyere Okoli, NTA News.
And following the first confirmed case of coronavirus in Osun State, all major markets will be closed down from this Friday by government. The state governor, Gboyega Oyetola, made this known in Osogbo while briefing journalists on the latest development and measures put in place to contain the spread of the disease. Femi Afariogun reports.
In 3 days, this is the second time Osun State Governor Gboyega Oyetola will be addressing the media on coronavirus pandemic. The governor, who confirmed that the case in Osun is a returning from United Kingdom and currently receiving medical care, noted that contact tracing has also commenced.
To further contain the spread, the following measures take immediate effect. All major markets will be shut down with effect from Friday, March 27. However, traders are allowed to sell food items in front of their houses. Pharmacies are also exempted from this ban.
He appealed to returnees, especially from high-risk countries, to self-isolate and submit themselves to test.
And as a way of leading by example, I have also subjected myself to test. My wife, because of our recent travel history, also subjected herself to test. Both came back negative.
He confirmed that other centers have been set up at Ashubiaro State Specialist Hospital, Osogbo.
Governor Gboyega Oyetola is calling for calm. He said a task force has been set up by the state government to man all the state's land borders to examine people entering into Osun State. In Osogbo, Femi Afariogun, NTA News.
And from Osogbo, we'll take you to Owerri, where the Imo State government has procured hand sanitizers to be distributed to various agencies of government and other individuals as a means of tracking COVID-19 infection in the state. And Bright Abuja reports that the sanitizers were handed over to the Ministry of Health by Governor Hope Uzodimma for onward distribution at no cost to the people.
Governor Uzodimma, while flagging of the distribution of hand sanitizers in Imo State, directed the closure of nightclubs and late-night restaurants, while also directing civil servants within the age bracket of 40 and above to stay at home.
Coronavirus is real. It's very dreaded. So the rate with which the thing is spreading across the country and the globe is very alarming now. So we must be very vigilant. We must also guide against anything that will encourage this disease coming into Imo State.
Director of Ministry of Health, Dr. Daniel John, assured the governor that the hand sanitizers will be judiciously distributed.
This is the first time we are seeing this type of magnanimity, and it is under your government that Imo State was privileged to have an isolation center.
The procurement of hand sanitizers by the Imo State government is in commitment to the prevention of coronavirus in the state. In Owerri, Bright Abuja, NTA News.
And Anambra State government has ordered civil servants in the state to work from home starting from Tuesday, the 24th of March, till further notice, as a measure against the spread of coronavirus. Governor Willie Obiano announced this in a state broadcast at the Governor's Lodge, and Uchenau Nwekoyo has the details.
The civil servants that are to work from home excludes health workers and those on essential duties. Governor Obiano also ordered immediate suspension of all gatherings of more than 30 persons in the state.
These directives excludes all staff of the Ministry of Health and all staff of the Ministry of Works and other officers on essential duty. All public gatherings are hereby suspended in Anambra State, effective immediately.
The state governor also ordered the immediate suspension of all nightclubs and restaurants till further notice.
All academic and extracurricular activities are hereby suspended. All public transport operators are directed to submit the manifest of all passengers coming to Anambra State to the appropriate authorities with their names, phone numbers, residential addresses, and final destination. The general public is mandated to maintain a habit of frequent hand washing with soap and water, as well as use of alcohol-based hand sanitizers.
Consequently, the governor has set up a 22-man adversary action and prevention committee comprising of a renowned virologist and former INEC chairman, Professor Maurice Iwu, and headed by himself for immediate action should any case arise in the state.
Please stay at your home and work from there.
From Oka, Uchenau Nwekoyo, NTA News.
In another story, tertiary institutions in Benue State have shut down academic activities in compliance with the NUC directive as part of measures to contain the spread of COVID-19. Elias Ichiav, who visited the Benue State University Makudi to monitor the situation, reports that the students were seen vacating the campus.
With the outbreak of the COVID-19 across the globe and its ravaging effects, several measures have been adopted by government and corporate organizations in order to curb the spread of the virus in Nigeria. One of such measures is the federal government's directive that all tertiary institutions and unity schools across the nation be shut down. This is the first gate of the Benue State University, where it is always a beehive of activities. But as you can see, the school is deserted with very many students out of the school already and some packing out.
So I was planning on resuming 300 level by next month, but now I was not coming back to write exams again. So, but all the same, that's how God wants it. So
the 300 level, 400 level, who's supposed to graduate now based on this, so they are carrying them to April or May.
Authorities at the university say, with regard to the second semester examinations which are ongoing, papers previously taken remain valid, while those that are yet to be taken are suspended till further notice.
Intention is to stave off the spread of this coronavirus. Staff were also asked, some that are not on essential duties were asked to stay at home.
The students are hoping that
the outbreak be contained soon to enable them return to their classes. In Makurdi, Elias, Etiaf, NT News.
And still to come tonight, health at all costs. While some have been advised to sit at home, the state is taking no chance. It has imposed a curfew. Details shortly. Please stay with us. Great to know you're still with us on News Extra. Various states in Nigeria have come up with measures to curb the spread of COVID-19, which has spread to more than 169 countries across the globe. In this report, Fatima Sanusi examines the level of compliance amongst people in the ancient city of Kano, a state that is densely populated and a home to many nationals.
The suspected case is of a 17-year-old boy who flew from Lagos to Kano with Air Peace Tuesday morning. The boy was said to have vomited in the aircraft. Upon landing, the pilot refused to open the airplane for safety reasons and called for the attention of Center for Disease Control (CDC) team of experts to examine the boy. He was then rushed to the airport isolation center where a preliminary test was run, and it was determined by the co-chair, Kano State Task Force on COVID-19, Professor Abdulrazak Habib, as negative and did not display any symptoms of the deadly virus. Special Assistant to Kano State Governor Salihu Tanko Yakase shed more light on the issue.
Preliminary investigation revealed that the passenger was a first-time flyer in an airplane and also has a little bit of history of malaria. So that led to the situation.
Taking extra precaution, the CDC team collected data of all passengers on board and spread them with disinfectant as well as the aircraft. The best safety measures still remains, as experts say, stay at home, practice social distancing. In Kano, Fatima Sanusi, NTA News.
Most Nigerians are complying with the stay-at-home directive of the federal government as part of urgent measures to safeguard the lives of civil and public servants and all Nigerians in general from the novel coronavirus. Leneke, who monitored the day one of the partial lockdown, reports.
It's a weekday and Lagos roads are devoid of the usual heavy traffic and gridlock. While most offices are closed, essential staff in specific offices reported for duty. At some major parks, the number of buses waiting to convey passengers were few. The passengers did not amount to a crowd. Tassi and Godwin are essential service workers whose services at a time like this is critical.
Even in the hospital, the influx of patients are reduced because many people are home. Some will come and not even want to stay that long and then, go home, unlike the way they usually come, feel relaxed.
I know a lot of people are not believing that it is real, but it is real.
While commending the initiative, respondents urged Nigerians to take the mandatory stay home seriously.
But I believe what the government said is a welcome development so to curb the spread of coronavirus.
I wouldn't advise somebody to be going at least at a long distance, mostly in a town that the index case has been pronounced.
The stay-home directive takes effect until further notice. In Lagos, Lane Lenake, NTA News.
Thank you so much, Len. Now, Director General, National Council for Arts and Culture, Segun Ronshare, has called on culture and tourism players not to lose faith about the sudden outbreak of COVID-19. The NCAC boss believes the industry and practitioners will survive the scourge if the medical and hygiene culture protocol are strictly adhered to by all and sundry. The DG noted that the closure of our land borders and restrictions of air travel will mitigate the spread of the dreaded infirmity, praising federal and state governments' response to curb the spread of COVID-19 in Nigeria. He urged Nigerians to pray and ensure practice of personal hygiene as well as comply with all the precautionary measures to stay safe. And and federal and state civil servants in Anambra State have complied with the work from home directive issued by the federal and state government effective from March 24th, while commercial bus drivers and tricycle operators in the state are yet to heed to the mandate given to them on number of passengers to convey at a time. And Chinyere Fesi-Okoye has the report.
A visit to the Anambra State Secretariat and the Federal Secretariat in Awka, the state capital, revealed that civil servants in the state actually complied to the order. Those who came around at the State Secretariat to transact one business or the other were not given access into the premises.
I came here this morning to come and sign some documents in the bank, which is situated here. As you can see, this is a State Secretariat. But I was not permitted to enter.
I came to submit my code of conduct, but they said that everywhere is shut down. Even me, myself, I didn't go to work today because of the problem that we are facing in the country.
However, the essential duty workers, the media men, security operatives, health workers and others of like minds are seen on their duty posts.
Our job is really a taxing one, and is one of the risks of the profession, because while others are staying at home, you have to go around and tell people what is really happening.
So when others are at home and you are working for the society should appreciate you with some form of allowance, incentive. Today, 14 days, nobody is coming out because people shouldn't get exposed to the coronavirus. But you now discover here and now that those of us who are doing essential duties are exposed to the virus.
Our crew also visited some motor parks in Anambra State to ascertain the level of compliance of drivers on the directive by the state government that no keke or tricycle operator should carry more than 2 passengers, while drivers of shuttle buses, township and minibuses must not carry more than 3 and 5 passengers respectively at a time.
How I'm going to comply is that if the government will surely cut all the tax imposed on us. If each keke carry 2 passengers, who will bear the cost?
Issuing such a directive is one thing, while its enforcement is the most challenging aspect.
We are going for enforcement. You know, our people, they always like to be policed around.
We are working as seriously with the Nigerian Police Force, who is the anchor for all the paramilitary agencies here in the state, to ensure that people comply with the precautions set out by the state government.
Meanwhile, with the increasing rates of COVID-19 in Nigeria and the world at large, it is expected that those on essential duties and other citizenry should tread with caution to avoid its spread. In Awka, Chinyere Fesi-Okoye, NTA News.
Very necessary for us to tread with caution. Now, Ondo State government has imposed a stay-at-home directive on its workers from level 12 and below, as well as banning public gatherings and market closure for non-essential items as part of preventive measures against the spread of COVID-19 in the state. And Olajide Bello monitored the level of compliance in the state capital and now reports.
Although the state has no record of confirmed case of COVID-19, the issue on how to contain its spread, especially through person-to-person transmission, remains crucial. To address this, the state government issued a stay-at-home directive for its workers from level 12 and below, with the exception of those on essential services. The Ondo State government is also complying with the federal government directive on social distancing, and this particular ministry houses environment, health and education. We are here to find out whether this directive of grade level 12 and below to sit back at home till further notice is being strictly adhered to. The atmosphere at the State Secretariat and Governor's Office was devoid of the usual hustling and bustling, as major offices were less congested, while workers on duty complied with the preventive measures approved for workers.
For the senior officers on level 13 and above, and as well as the political office holders, they have the option to work from home. That's part of the protection. Then we have provided sanitizers in the offices. And many of the offices have facilities for hand washing. We have also limited the number of guests, visitors that come to the office. These are ways of ensuring that we have minimum contact with outsiders.
The situation at the Federal Secretariat at Akure was not different, as only workers on essential duties reported for work.
Check out there, I had to place a sanitizer for everyone who wants to go out and come in.
For us as a corporate entity, we've taken measures in our facilities, just as we were directed by our Director General, and those are the things you can see we have put in place in this place for now.
The government has also ordered closure of markets in the state, especially for traders selling non-essential items. However, our visit to some major markets in the state capital shows that some traders have complied with the order, but for many it was business as usual.
Nobody sits in the eatery to eat. Go in, buy and leave.
Before I'm open by 12, by today now no open, because it's people that are selling medicine, food. That's people that government permit.
The state government emphasized the need for people to abide by all its preventive measures to curtail the spread of coronavirus pandemic in the state. Olajide Bello, NTA News.
Similarly, the sit-at-home order by the Cross River State government to curtail the spread of coronavirus and prevent a possible outbreak in the state has been described as a step in the right direction. Achibong Basi, who monitored the situation in Calabar, reports that there is a strict compliance with the directive by the people of the state.
We are here at the State Secretariat. Before today, we would have seen workers rushing into their offices, but that is not the case, as they have to comply with the state government directive to sit at home as part of measures to curtail the spread of coronavirus outbreak in the state. Apart from affected public and private organizations enlisted in the shutdown, residents are going about their normal businesses, but with levels of precautionary measures. The people commend government efforts at curtailing the spread of the coronavirus.
Good for the government to shut down all the activities, especially the ones that has much gathering.
But will motorists in the metropolis comply with the directive of 1 passenger for keke and taxi drivers and 2 passengers for bus drivers?
Yes, I suppose I want to say money because our tax here is too much. We are buying ticket 500 naira and we are paying loading money here, each ton 50 naira.
Can drivers afford the use of sanitizers in their means of transportation for passengers?
Protected myself, so if I, the means of contamination is through my hand or their hand. So if I'm getting their money and with hand gloves, so I think it's okay for now.
Health experts say it is needful for the people to support government efforts to contain the spread of the virus. In Calabar, Achibong Basi, NTA News.
And the restriction of movement from 8 o'clock in the morning to 8 o'clock in the evening put in place by the Niger State government to check the spread of COVID-19 pandemic recorded relative compliance on its first day of implementation in Mina. Dr. Mohammed, who monitored the level of compliance, reports that 7 persons are on self-isolation in the state, having been in contact with a confirmed case of the coronavirus.
This is the epicenter of most activities in Mina, the Niger State capital, and the recent restriction of movement imposed by the state government to check the spread of coronavirus in the state from 8 a.m. to 8 p.m. This area is now deserted. However, we still have pockets of motorists and pedestrians that have been defying the order, prompting security agents to put up a barrier here to check their movement. Though most business premises were shut, banks were observed allowing customers use the automated teller machines, while the Abdulkarim Lafeni Secretariat complex was still open, with senior civil servants giving unhindered access.
I believe, because I can see the main road not looking very busy, so I believe people did.
I work with the Ministry of Justice, and as a staff officer, I came to pick up the clearance of the coppers, because I'm in charge of the coppers of the ministry.
We don't have wife, we have to eat. So that's the problem, sir. I'm not saying that I'm not in support. I'm not saying that I'm in support, but let the state government look at it and see what is happening to the masses. Because people are suffering seriously.
The major roads in the city center were devoid of the normal busy vehicular traffic, providing opportunity for children to have a game of football to entertain themselves. The Abdulkadir Kure ultramodern market Mina was also closed. However, a couple of traders could be seen selling some perishable items to customers. As expected, the Mina General Hospital was busy providing services to patients. However, sensitization and information on the coronavirus in Mina was still observed to be low, with most residents still confused on the mode of transmission and protection.
The coronavirus where we are talking about, they say it's moving by hair, but I don't know, maybe it's by hair. Some people will say it's by shaking.
Amidst the global economic downturn being experienced as a result of the impact of the coronavirus pandemic, the Niger State government has also announced the downward review of its 2020 budget from 155 billion to 98 billion naira in tune with present realities. In Mina, Dauda Mohammed, NTA News.
Meanwhile, workers in Kebbi State have complied with the stay-home directive of the federal government as proactive measure to curtail the spread of COVID-19. Nora Tanko reports that the Kebbi State government has also instructed its workers to follow suit except those on essential services.
The directives of the federal government is coming at the heel of the ravaging scourge of COVID-19 and its impact on the socio-economic condition of the world. The action was therefore to contain the spread of the virus, as Nigeria has already recorded a number of cases. The workers therefore welcomed the directives and assured of continued compliance until further directives.
I'm just coming into the office now and I saw the circular. It is a very good and welcome development because the government is after our well-being and after our health.
As we have seen the circular, every worker is intended to go back home.
It is when you are healthy, then you'll be able to deliver. So the Kebbi State government considers the health of its citizens first.
In spite of the directives, essential workers such as security and health personnel, as well as media practitioners, are on skeletal services, but with strict preventive measures.
My service is very much needed, so I need to be in the office at all times. I have been in the office as early as 8 o'clock this morning.
I'm a media person, so we should inform, we should educate, we should enlighten the people, especially now as we are facing the deadly coronavirus.
We have to give information on how to contain the pandemic.
At the time of NTA News visit to some public institutions, hand-washing points and sanitizers were provided to ensure protection from the pandemic. Nora Tanko Akili, NTA News.
All right, in the concluded segment of the news, the world goes to trenches, to fight the virus that is in the killing mode, plus a bit of sports. Stay with us. Welcome back. The death toll from coronavirus in Spain is now the second highest in the world, exceeding that of China. And Joyce Ometu is standing by for a global update on the pandemic.
A quarter of the world's population are now living under lockdown. COVID-19 global cases now exceed 400,000, with deaths approaching 20,000 and more than 100,000 recovered cases. According to the World Health Organization, countries with the highest cases include China, Italy, and the United States. And countries that has the highest death toll in the world are Italy, Spain, and China. In Africa, COVID-19 cases across the continent are now well above 2,400, with Mali, Libya, and Guinea-Bissau announcing their first. 46 of the continent's 54 countries now have the virus. The highly coronavirus-affected African countries include South Africa with 709 cases, Egypt with 402 cases, Algeria with 264 cases, and Morocco with 170 cases as of Wednesday. The African Center for Disease Control and Prevention indicated that the countries that have no recorded cases are Sierra Leone, South Sudan, Burundi, Malawi, Botswana, Comoros, Lesotho, and Sao Tome and Principe. The number of deaths due to the pandemic rose to 64 as of early Wednesday. while the number of people who have recovered from the virus has also increased to 203. Let's look at some key developments in other parts of the world. The Prince of Wales has tested positive for coronavirus. Prince Charles, heir to the British throne, is displaying mild symptoms but remains in good health, a spokesman said. Adding that the Duchess of Cornwall, 72, has been tested but does not have the virus. India, a country of some 1.3 billion people, is in complete lockdown. The restrictions came into force at midnight local time and will be enforced for 21 days. The death toll in Spain from the coronavirus has officially surpassed that of China to become the second highest in the world. Report from Brazil says the country's President Jair Bolsonaro has downplayed the threat of the coronavirus, calling on officials to roll back restrictions they have put in place to curb its spread. Meanwhile, the United States President Donald Trump and the Senate have agreed a massive economic relief package worth more than $1.8 trillion. And that's today's edition of Global Updates on COVID-19. We will bring you more as events unfold. I am Joyce Umitu.
Thank you so much, Joyce. And President Muhammadu Buhari sends condolences to government and people of Cross River State and National Assembly over passing of the senator representing Cross River North, Rose Okoju Oko. The president believes the senator's historic service to the nation of the National Assembly, beginning from the House of Representatives, will always be remembered, affirming that her long stay at the legislature clearly testifies to her popularity and acceptance as one of the women who championed development issues at the National Assembly, especially on girl-child education and health. President Buhari notes with sadness that her voice and experience will be missed. President Buhari commiserates with family of the deceased, her friends and political associates, praying that the Almighty God will continue to comfort them while urging them to find strength and solace in her legacies of service to God and humanity. And the Emovong family of Benin has announced the death of former Minister of Science and Technology and Pioneer Coordinator, Shedda Science and Technology Complex, Abuja. Professor Emmanuel Emovong, one-time Vice-Chancellor, University of Jos, died at the age of 89 and is survived by a wife, children and grandchildren and great-grandchildren. He will be giving a private burial by immediate family on Friday, 27th, due to the prevailing situation of COVID-19 in the country. And with that, we conclude News Extra for tonight. Thank you so much for watching. I am Fatima Umar Buba. Enjoy the rest of your night.